We have certainly noticed that with this Delta variant, just as they've noticed in the States, that our number of pediatric cases have gone up significantly. I think families have noticed and seen that as well too. And so we have families right now calling us, my son turns 12 on September 28th, will I be able to get a vaccine for him at that point? And so I think we are seeing families, seeing the increased number of cases, yes, they're wanting to get it for their children.
I think the kids are affected greatly by the pandemic. Even if you take away hospital outcomes, obviously mental health has been a big issue. I would say since this has started, we've had vastly more mental health hospitalizations that I would put down to stresses from the pandemic than we have had medical ones.
Some of the mental health issues, one in particular, eating disorders that we've seen, is probably more in this last year and a half than what Dr. Bates and I have seen combined in the last 10 to 15 years, which is just an incredible surge in that diagnosis alone, not talking about the anxiety that children could be feeling, the effect on mood and depression that can be seen as well too, and some of that necessitating admissions to hospital as well too.
And if you think back to your preteen, early teen years, there's a lot going on, and when you think of the uncertainty for kids, most of their lives right now with the pandemic have been somewhat taken out of their control. I mean, whether you're allowed to go to school or not, whether you're allowed to associate with friends or not, all of this just gets dictated. So sometimes what it boils down to is there's some things you can control, and those are the things that you hyper control when you're in those situations. And I think that's what we see sometimes with the eating disorders.